Yeah, so for today's session, we will be doing some common kidney diseases. Okay, not the diet part, just I'll just give you a brief about the lifestyle changes to prevent kidney diseases. The diet part we will do next week for Tuesday classes. Okay, diet in kidney disorders. The dietetics part we will do in the next week Tuesday classes. Okay, here we will just only describe or discuss kidney disorders in brief. Okay. So kidney diseases. Kidneys are the vital organs that filter fluid and waste out of your blood, and you cannot live without them. Okay. Kidneys, the diseases that lower your kidneys' ability to clean your blood can affect only the kidneys or harm other parts of the body too. Okay. For example, diabetes, hypertension, cardiovascular diseases over a long run, it will not just damage your kidney, but it can have some life-threatening damages on your other organs as well. Okay, these health conditions can cause chronic kidney diseases or kidney failure. It starts with acute. If acute is not treated at the right time, or if it's not diagnosed at the right time. Okay, sometimes the disease condition have already begun, and even if you do not have any symptoms, the disease condition has already begun. It has begun. It has already crossed its acute stage, and by the time you diagnose it, it is already in its chronic stage. Okay, so if it leads to chronic kidney diseases, you may require a dialysis or you may have to go for a transplantation. Or if it is still not treated, if treatments are not given, it could lead to permanent kidney failure and even death. Okay. So this is the structural and functional unit of the kidney, the nephron. Okay, most kidney diseases attack the nephrons. This damage may leave the kidneys unable to remove the waste, because you can see here, renal artery will bring all the blood. Renal artery will bring all the blood into the glomerulus. Here the filtration will take place, and from the glomerulus, the renal vein will take the blood into this tubule, collecting ducts and tubule. This is where the filtration, some other filtration of electrolytes will also take place. Okay, so this nephron is a structural and functional unit of the kidney. It's a cell. Okay, each of these cell is responsible for filtration. Okay, so most of the kidney diseases, apart from stones get accumulated, but other kidney diseases, nephrons get damaged. Okay, so this damage may leave the kidneys unable to remove waste, because their basic function is to filter out and remove waste. Okay, this causes the causes of this nephron damage could be genetic, like autoimmune disorders, injuries, or certain medications. Okay, that can also increase your risk. You have a higher risk of kidney diseases if you have diabetes, high blood pressure, or close family member with kidney diseases. It is a genetic condition. Okay, certain kidney diseases are genetically transmitted from the family to the offspring. Okay, chronic kidney diseases called as CKD is when lasting damage to your kidneys causes them to lose their ability to filter waste and fluid out of the blood. Waste can build up in your body and it can harm your health. Okay, you will and the waste will try to get out of the body through other means. Okay, like sweat, and your the skin itch will begin. There are different symptoms. Okay, by the time you reach chronic kidney disease stage, CKD stage, there is a lot of symptoms that makes your living, day-to-day living, very difficult. Okay, this damage and your kidney function can get worse over the time. And when your kidney stops working completely, this is called kidney failure or end stage renal disease. Okay. So in CKD also, the only treatment option you may have is to get a transplantation done or to be on dialysis. And chronic kidney diseases, majority of acute kidney diseases, inflammation, infection, stones, okay, it can lead to chronic kidney diseases. Okay. Chronic kidney diseases, stages of chronic kidney disease. Stage 1, normal functioning disease. It's a healthy disease. Stage 2, mild loss of function. Stage 3, moderate loss of function. Mild loss of function, it's not symptomatic. You will not be able to find the symptoms that easily. We will come to the diagnostic part later. Okay, now just understand the diseases first. So in stage 2 of majority of the acute kidney diseases, usually you will not be able to diagnose it through the outward symptoms like urination or the discharge, color discharge, and the color of the urine. Okay, other symptoms like pain. Usually it won't happen in the stage 2. But stage 3 onwards, you will start seeing some symptoms which have to be treated. Okay, which may make the day-to-day living difficult. Stage 4 onwards, severe symptoms will be visible, and stage 5 is complete failure. Okay, that is also stage 4, and stage 5 comes under the category of chronic kidney diseases. Okay, so from normal function to stage 3, it can be any kidney diseases. Okay, which we will discuss later on. Any of the kidney diseases can come in the stage 1 to stage 3 situation. Later, if it is untreated or the prognosis of the patient is very poor, it will lead to stage 4 and stage 5. Polycystic kidney disease, PKD. Cyst, if you remember from the last class, I have mentioned cyst means any fluid-filled cavity. Okay, so polycystic kidney disease, poly means many. Cyst means fluid-filled cavity. A lot of cyst, small fluid-filled cavities are found in the kidney. Okay. So PKD is a genetic condition, the genetic disorder that causes cysts. Growths will or fluid will fill into these cavities and it will form your kidneys, or in other organs as well. These growths can form, but when it happens in the kidneys, we call it as a polycystic kidney disease. If there is just one cyst, it is not polycystic, it is a cystic kidney disease. But if there are more than one cyst spread around the kidney, spread throughout the kidney, it is called polycystic kidney disease, PKD. Okay. Over time, PKD can cause kidney failure as well, and there is no cure for PKD, but treatments can slow the growth of cyst. It can prevent PKD symptoms. Surgery is also another option. Okay. Laparoscopy. Through laparoscopy, also certain cysts can be removed if it is too big. Laparoscopy can help. Laparoscopic surgeries can help. Okay. So symptoms will be very difficult to manage the symptoms. Symptomatic management has to be done here. Depends on what is the prognosis of the patient. Treatment is given to the patient. So this is how a normal kidney looks like, and this is how a polycystic kidney. You can see here, many cysts. Each of these cysts, these cavities are filled with fluid. Okay, so this is polycystic kidney disease, PKD. Just give me 1 minute. Next condition is lupus nephritis. It's an autoimmune disease. Okay, here the immunity it's genetic. Lupus is also sometimes it is called lupus. And if the lupus autoimmune disease is attacking your kidneys or the nephrons, only then it is called lupus nephritis. There are different forms of lupus. Okay, lupus, it's an autoimmune disease, but in this autoimmune disease, your Ig, your immunoglobulins, your antibodies can attack any part of your body. But if it is attacking your nephrons, then we consider it as lupus nephritis, because inflammation will be caused on the nephron. Okay. So autoimmune diseases cause it's an autoimmune disease. Autoimmune diseases cause your immune system to attack your own healthy cells. So it can affect many parts of your body. So when your immune system attacks your kidneys, it is called lupus nephritis. Okay, it's genetic. It does not spread. It's not communicable. It's just genetic. And it could be an inborn errors as well. Okay, autosomal dominant or autosomal recessive disease condition. I'm not sure which one it is. Is it recessive or dominant? But it is rare. Okay, lupus is a rare condition, so it could be a autosomal recessive condition. Both the parents, if they have this trait, lupus trait in their genetics, only then the offspring can get it. Okay, autosomal dominant means even if one parent is having this genetic uh, error, it could be very easily be transmitted to the offspring. In autosomal recessive conditions, both the parents should have this genetic error. Only then one of the offspring may get the lupus condition. Okay, so it is an autoimmune condition, very rare. Then we have glomerulonephritis. Glomerulonephritis. So here glomerulus, that is the that capsule which you, if you remember the nephron, you can see here a small capsule form. Okay, this is the glomerulus. This will undergo inflammation. Only this part, not the collecting duct, not the distal part, not the other part of the nephron. Only the glomerulus of the nephron will be inflamed. Okay, this is the Bowman's capsule, and under the Bowman's capsule is your this. You can see capillaries tangled completely. Capillaries are completely tangled. Is it visible to all? You can answer in the chat box. You can see the small portion of capillaries tangled. This is the glomeruli. This tangled form of blood vessels. This is the glomeruli. Okay, and this yellow part which you see is the Bowman's capsule. Bowman's capsule. And then you have the collecting duct, distal tube, renal tube, etc. So when there is an inflammation exactly on the glomeruli, that's when you get glomerulonephritis. Okay. Your kidneys contain more than a million glomeruli because it is cell. Okay. Million nephrons means million glomeruli. Okay. Which are tiny filters that will remove waste and fluid from your blood. If anything damages your glomeruli, which is called glomerulonephritis, they cannot do this job well. So no filtration will take place. The waste will accumulate in your body over a period of time. And this accumulated waste will cause more inflammation, okay, as the days pass along. If it is not treated, glomerulonephritis can lead to serious kidney problems. It can include kidney failure as well. Okay, and this is the two classic sign of glomerulonephritis. There will be proteinuria, protein in your urine, hematuria, blood in urine. Okay, so if you are voiding out pink or red color urine, and if you have done the urine test as well, and there is protein, okay, albumin in your urine, if both of these are present, it is one of the confirming diagnoses that the patient may be suffering from glomerulonephritis. Okay. IgA nephropathy. IgA means immunoglobulin A. It's your antibody. It's an antibody we all have within our body. Nephropathy, it's a pathology of the nephrons. Here the nephrons is getting attacked. As I mentioned earlier, majority of the kidney diseases, your nephrons will be damaged. Okay. So again, this is it's a rare condition in which your own antibody, IgA antibody, will damage your kidney. Your immune system produces antibody, specifically the IgA antibody will damage your kidneys. It will damage your kidney cells. This will trigger harmful inflammation in your kidney, inflammation in the body's natural response to injury and infection. So this process lowers your kidney's ability to filter waste and fluid from the body. It is very common. This is a common pathology, pathophysiology, which we have discussed in all these kidney diseases. Once the nephrons are damaged, there is no filtration of waste, fluid accumulation, swelling, water retention. Okay, accumulation of waste will cause further inflammation. Okay, so it has a domino effect. One inflammation will damage one nephron, few nephrons, few cells in that area. Accumulation of waste will take place. It will further the damage. So it has a domino effect. Okay, there is no cure for IgA nephropathy, but treatments can slow the damage to your kidney. Usually, immunosuppressants are put. Okay, patients are put on immunosuppressants. No, little intake of water will, and you have a yellow urine, it means you are dehydrated. Okay, so you have a very stark, like bright yellow urine, it means you are dehydrated. Okay. Next, we have diabetic kidney problems or diabetic nephropathy. Both are, both the names are correct. Okay. So kidney damage from the diabetes is called diabetic nephropathy. It begins long before you have symptoms. This is the reason why people who have diabetes, they have to every 6 months they have to get their urine test done. Urine test along with USG ultrasonography of the abdomen has to be done. Okay, because they themselves will not know when the nephropathy has begun. Okay, so that is the kidney damage from diabetes is called diabetic nephropathy. It begins long before you have the symptoms. Okay, people with diabetes should get regular screenings for their kidney disease. Test includes urine test to detect protein in the urine, blood test to show if your kidneys are working well or not. If at all there is blood in urine, means nephropathy has begun. Okay, and then treatment for the nephropathy will also go along with the diabetic treatment, insulin medication or anti-diabetic drugs. Along with that, nephropathy medications will also start. So you can slow down the kidney damage or keep it from getting worse by controlling your blood glucose level, blood pressure, okay, and your medications, taking medications on time, not eating too much of protein can also help. Once the nephropathy has begun, you are not supposed to have too much of protein. Your protein has to be controlled because too much of protein, easily it can get passed through your glomerular filters. It can cause more harm and it can be released through the urine. So you have to control your protein intake as well. Sugar intake and protein intake has to be controlled once you're diagnosed with diabetic nephropathy. In detail, we will discuss in the diet of diabetic nephropathy. We will discuss in next week's class, Tuesday class. Okay. All the diet part we will discuss there. Next is kidney cancer. Kidney cancer becomes more likely as you age. Okay, as you progress, your chance of getting kidney cancer, specifically if you have a blood relative who had suffered from kidney cancer, you your risk of getting that doubles after you have crossed your midlife. After 35, 40, the risk of developing kidney cancer can double. Okay. Specifically, if you had any acute kidney, AKD, acute kidney failure, or acute kidney inflammation in the past, there are high chances that you may develop kidney cancer in the later half of your life after the midlife. Okay, if specifically if you have a family history of kidney cancer. Risk factors include smoking, having genetic condition, misusing pain medication for a long time, being addicted to pain medications, okay, and also steroids, okay. Symptoms include blood in your urine, a lump in your abdomen, tumorous lump, okay, weight loss for no reason because to to make this lump, the body will take up majority of your protein and fat because cancerous cells has to be produced, right? So that would lead to weight loss. Pain in your side, in the side that does not go away at all, loss of appetite. So these are the symptoms of kidney cancer. There are tests. Kidney cancer test includes blood test, urine test, imaging like CT, MRI can be done, ultrasonography can be done, and in some cases you can also go for biopsy to understand is it a malignant tumor or it's a benign tumor. Okay, malignant means it's cancerous. Benign means surgically you can remove it; it will not come back. Malignant tumors you have to undergo chemotherapy, radiation, combination of chemotherapy, radiation, and surgery. Okay. So there are different stages of cancer. If the tumor is less than 7 centimeter, it's stage 1. If it is more than 7 centimeter, stage 2. And it has expanded into the kidney veins or adrenal gland is also involved here, stage 3. Okay, it is found in the lymph nodes as well. If the cancer cells are found not just in the kidney, not just in the adrenal gland, but also in your lymphatic system, the lymph nodes which are near your kidney, even in these areas, if you find the cancer cells, it is a final stage of cancer. Okay, always remember, as soon as the cancer cells have infiltrated the blood vessels, the circulatory system, including the blood vessels and the lymphatic vessels. Lymphatic vessels are also a part of your circulatory system. Okay, so as soon as the cancer cells have surpassed your blood circulatory system, it means it can cause cancer at any part of your body. Kidney cancer, it started with kidney cancer, it can end up as lung cancer, uh, or any part of the body, because circulatory system will carry these cancerous cells to various parts of the body. Wherever it gets deposited, it may start a new tumor there. Okay, then we have kidney failure. Harmful waste can build up in your body. Your blood pressure may rise, your body may retain excess fluid and not make enough blood cells. This is called kidney failure. Treatment options are there: dialysis and kidney transplant. Okay, so kidney failure, it can happen through any of the diseases which we have discussed so far. Okay, stones, if it is untreated, that could also lead to kidney failure. And any chronic inflammation, that could lead to kidney failure. Acute inflammation untreated can lead to kidney failure. Okay, so there are various kidney diseases, if it is untreated, or even if it is being treated but the patient's prognosis is very poor, that could lead to kidney failure. Okay, so kidney failures are two types: acute kidney failure, CK, and chronic kidney failure. It could be any type of kidney failure. The basic bottom line here is your waste that is supposed to leave your body, toxins that are supposed to leave your body, because of the inability of the kidney or the nephrons to filter out these waste. These waste will build up in your body, it will build up in your kidneys, it will raise your blood pressure. Okay, it will cause swelling all over the body, edema all over the body, fluid retention in the body. Okay, and that leads to kidney failure. So you have to undergo other treatment, dialysis, and wait for kidney transplantation uh, as soon as you get a donor. Okay, until then you will be put on dialysis. And if the kidney transplant fails, again you will be put back on dialysis. Here it will be hemodialysis, not the peritoneal, hemodialysis. Next we have kidney stones. So kidney stone is a solid piece of material that forms in the kidney from substances in the urine. It may be as small as a grain of sand, or as large as a pearl. Most kidney stones pass out of the body without help from the doctor, but some stone will not go away. It may get stuck in the urinary tract, block the flow of the urine. It can also lead to great pain as well. Okay, so this is about kidney stones. And kidney stones, usually it happens to almost everyone, but the kidney stones which is very common are so small, okay, as a grain of sand, that automatically it will leave your body without even you knowing it, without giving you any symptoms. Kidney stones can leave your body. But because of certain external factors, like if you have a very sedentary lifestyle, you don't drink enough water over a longer period of time, okay, months and months of dehydration, not drinking enough water, your diet, what kind of diet you're having, is it too much of calcium rich diet, or you are on calcium supplements for a pretty long time. Okay, your body is producing a lot of uric acid, um, or any form of specific diet which is causing more acidic stones in your body. Okay, these are the external factors that will determine, will the stone be as small as sand, or it can accumulate in your nephrons and be a big stone which cannot be passed by urine. It has to be shredded using short wave technology, or it may have to be removed surgically. Okay, there are different treatment for kidney stones. Either you have to start drinking more water, and if the stones are too small, it will pass through the urine. And in the other case, the non-invasive case, is short wave technology, in which short waves are hit on your kidney, and it is supposed to grind off the entire stones, and then these grinded down stones can leave the body through urination without any surgery. And the final option is surgical treatment of stones. Surgically, the stones have to be removed. Okay, so these are the different types of kidney stones. Calcium stones are the most common one. Uric acid stones, struvite stone, and cystine stones. Cystine stones will happen if you have too much of protein. Too much of protein in diet can lead to cystine stone. Cystine stone happens when you have lots of protein in the diet. Okay. Uric acid stones will happen when your diet is rich in uric acid. You will have to cut down on a lot of fruits and a lot of FODMAP foods. Okay. Struvite stones are usually caused by UTI. If you are suffering from recurrent infections or UTI infections, okay, and the ammonia which is produced by this bacteria, that will lead to struvite stones. Okay. When bacteria is staying in your kidney for a long time, or even in your uh, urinary system for a long time, they produce a lot of ammonia, and this ammonia can deposit and form struvite stone. And specifically when the body pH is more alkaline, basic, okay, struvite stones can be made. When the body's pH is more acidic, uric acid stones are formed. Is it clear about kidney stones? Spinach and tomatoes is a good combo. Antioxidants present in spinach, it gets absorbed easily because of the pigment, the carotene pigment that is present in tomatoes. So these are the following signs and symptoms which you may observe if you have kidney stones and you require a physician's consultation. So if there is an extreme pain in your back or side that is not going away, that means you may have a kidney stone. Okay, it's a colicky pain. Colicky pain, it is sudden pain. Okay, colicky pain, sudden, sharp pain, which is extending from the side or the back and it is moving forward towards your groin. Okay, that's a colicky pain, sudden sharp pain. Okay, that is starting from the back or side of your body and it is moving forward towards your groin. Okay, and blood in urine, sometimes if the stones are too big, it can cause erosion and at the tissue level in the kidneys, and because of this fresh erosion, blood will be released into the urine as well. Fever and chills, if it is uric acid stone, you will have a lot of fever and chills. Sorry, struvite stones. Vomiting, vomiting is the body's way of taking out the toxins through mouth. Okay, urine that smells bad or looks cloudy, burning feeling when you urinate. Okay, so these are the signs and symptoms of having kidney stones. Next is kidney transplantation. Kidney transplant is an operation that places a healthy kidney in your body. If the transplanted kidney takes over the work of two kidneys that failed, you will no longer require a dialysis. Okay. If the transplantation is successful, you will no longer require a dialysis. But even after transplantation, it happens that the body rejects the transplanted new healthy kidney and the patient may again be put on dialysis. Often the new kidney will start making urine as soon as your blood starts flowing through it, but sometimes it takes few weeks to start working. So if you have a transplant, you must take drugs for the rest of your life to keep your body from rejecting the new kidney. Okay. So these drugs that you take for the rest of your life is your immunosuppressant drugs. It suppresses your immunity to a point where you are protected health-wise, not you are not that vulnerable, but your antibodies will not reject your kidneys, will stop attacking your kidneys or cause minimal damage only. So these are the kidney test. These different kind of test is usually prescribed to you by your consulting nephrologist. The nephrologist will decide which test has to be done, or they may already have an idea based on your signs and symptoms what you may be going through. But just to confirm the situation, okay, they may choose the specific kidney test. So first is the GFR test, glomerular filtration rate test, one of the most common blood test to check how what kind of functioning is or what kind of filtration is happening in your kidneys. Okay, it tells how well your kidneys are filtering the blood and toxins out. Then we have the creatine levels, creatine blood and creatine levels in the blood and creatine levels the urine test. Okay, you have to check the creatine level, creatinine level in your blood as well as in the urine. Okay, if the creatinine level in the blood is too high, it means kidneys are not able to remove the creatine from the body. Okay, so creatine is a waste product that your kidneys have to remove from the blood. If the creatine levels are too high in your blood, it means kidneys are not doing its function properly. There is a range. Okay, normal creatine level range is mentioned. You can check that on Google as well, or if at all you have done the creatine test. So usually it should be between 0.7 to 1.3 mg per deciliter. For men and women, slightly different creatine levels are mentioned, but usually a normal test creatine level should be between 0.7 to 1.3. If your creatine levels in your blood is more than 1.3, it means your filtration is low. Okay. Creatine is a waste product. Okay, it's a body waste that is supposed to leave your body. Okay, that has to be left out from the body through your blood has to be blood has to be filtered out of creatine. An albumin urine test. It checks albumin urine test is the protein urine test, okay? To check if your urine has protein or not. Check for albumin, a protein that can pass into the urine if the kidneys are damaged. A healthy functioning kidney will not allow the albumin to pass through it and go into the urine. But if if it is a damaged kidney, a protein may be there in the urine. Okay, protein is usually there. So that is proteinuria. If you have albumin in the urine, it means you're suffering from proteinuria. Then imaging tests are there, like ultrasonography, okay, USG scan, that can take the abdominal ultrasonography, okay. So these pictures can also help your radiologist as well as your nephrologist to understand the normal size and shape. If the size of the kidney is too big, either it is inflamed, swollen, or there is a tumor in the kidneys, okay. So check for anything that is unusual. You have to determine what is the size of the kidney, okay. If there is any drastic change in the size of the kidney, there are high chances that you're suffering from some kidney diseases. Then we have kidney biopsy, a procedure that involves taking a small piece of kidney tissue. Usually, if you want to confirm a cancer or you want to differentiate a tumor from a cancer, you usually have to go for biopsy. Okay. So in this biopsy test, a small piece of your kidney tissue, specifically the tumorous part of the kidney tissue, is removed, examined under microscope to check that is it a damage? How far is the damage? Is the cells well differentiated or not? If it is a well differentiated cell, we can understand it's a tumor. Surgically, you can remove it and the patient can be back to normal. But if the cells are not well differentiated, okay, high chances that this is a cancer. Okay, so that's about kidney biopsy. So these are the steps that you can take to keep your kidneys healthier and live a healthier, longer life. So choose food which is less with salt, sodium, okay. Natural foods as well. That is when we will do the kidney diseases chapter, diet and kidney disorders, next week. I'll show you the list of fruits, vegetables, naturally plant-based food available, okay, in which you have sodium levels which are drastically low. It's good for kidney patients as well as for cardiovascular patients. Okay.
Where is the children?
Control your blood pressure. Your this is only for people who already suffer from hypertension or who are suffering from cardiovascular diseases. Control your blood pressure. Your healthcare provider can tell you what your blood pressure should be. Okay. Keep your blood sugar levels low in the target range. If you have diabetes, limit the amount of alcohol that you drink if you are alcoholic. Okay. Limiting the alcohol or even trying to stay away from the alcohol is good for your health in long run. Choose foods that are healthy for your heart, like fresh fruits, vegetables, whole grains, low fat dairy food, low fat food. Okay, completely avoid trans fat, saturated fat as much as possible. Lose weight if you are overweight. If your BMI is above 27, 28, definitely focus on losing some extra kilos. Okay, be physically active as much as possible. And if you have smoking issues, quit smoking. Okay, so these are the general healthy steps, not just for your a healthy kidney, but in general for your general well-being. All these steps will aid you. So that's the kidney conditions, diagnosis, common diagnosis, common steps, common lifestyle changes that you can do to prevent kidney diseases, and most common kidney diseases we have discussed in today's session. Now about the specific disease conditions and what kind of diet you should have, specific disease conditions and what kind of diet you should have, that part we will discuss in next week's Tuesday class. Okay. Is today's class clear to all? Please mention in the chat box.